be learning about heart arrhythmia. The questionnaire you just filled out will be corrected now. So make sure you correct your own answers and don't be afraid if you get something wrong. The first question, 1 in 100 babies born in the U.S. has a heart defect. What do you guys think? Yeah, Jessica.
I said true.
That is true. The heart has 6 chambers. True or false? Yes, Caitlin?
I said true.
That's false. Does anybody know the correct answer? Yes.
Is it 4?
It is. Do you know what they're called?
No, but I remember that there's 2 top and 2 bottom.
There you go.
Chambers.
We'll get into that later. The chest pain is a symptom of having a defect. What do you think?
True.
Yes, it is true. But there are also other symptoms from having a defect, so don't always rely on having chest pain. Scientists have not developed any new ways to fix heart problems in the 21st century. Yes.
False.
That is correct. The study of the heart is cardiology. Yes, Isabella.
True.
Correct. Heart defects are birth defects. Yes, Eva.
True.
It is true. All heart defects are found at birth. Yes, Isabella.
False.
That is correct. They can be found later in life, but most of them are found at birth. Arrhythmia is when the heartbeat doesn't beat like a normal heart. Isabella?
True.
That is correct. The heart is the center of our respiratory system. Yes, Jessica?
False.
That is true. It is the center of our regulatory system.
Wait, so I got it right or got it wrong?
That's right.
They said true.
Sorry. A heart transplant is never needed to fix a heart problem. Isabella?
False.
That is correct. And do you know who just got a heart transplant earlier this week?
Who?
Vice President Cheney. Some hearts have holes in them that are not meant to be there.
True.
That is correct. That's another heart defect that we won't go into today. The sinus node creates the heartbeat.
False.
Want to change that answer?
True.
That's better. Yes, the sinus node creates the heartbeat, and we will go into what creates the heartbeat and where the heartbeat travels before going out of the heart. We have made artificial hearts to replace a failing heart. Yes, Caitlin?
True.
Do you know what the heart is called?
The heart.
It's called the Berlin heart, and it can help, it can take over the role of a failing heart. You may never know the specific cause of heart defects.
True.
That is correct. And if you have a defect, it cannot be completely fixed completely. It will never be perfect. Isabella?
I said true.
Yes and no. So this one is debatable because you could have a new heart and then you wouldn't have a heart problem anymore. But if it's not serious enough to have a new heart, it might never be fixed because it doesn't need to be fixed. So now we will go on to the anatomy of the heart worksheet. Which is the top. Yep. Okay, so we're going to label the parts of the heart. So Isabella already mentioned that there's 4 sections of the heart called chambers, and the lower ones are the ventricles. And so this is the right ventricle, and this is the left ventricle. So this is like looking at me this way. So right ventricle, left ventricle. The top chambers of the heart are called the atriums. So we have the top is the right, so this is the right atria. And this is the left atria. And then this valve here is the pulmonary vein. And we talked earlier about the sinus node and how it creates the heartbeat. This is the sinus node. So, now we're going to move on to the bottom of the worksheet and look deeper into what causes the heartbeat and more about the heart. So, there are how many chambers of the heart again? 4. The upper 2 chambers are the atrium. This part of the heart receives the blood from the body. So the lower 2 chambers are called the what? Did you have a question, Caitlin?
No.
So it is their job to pump the blood from the body as the atrium receives the blood. For a heart to work like it should, all chambers of the heart need to work in sequence. So now we're going to move into what the heartbeat is and how it's
I
caused.
have a question.
Yes,
Why is the right side of the heart bigger than the left side?
that is just the way our hearts are. So the sinus node is a pacemaker of the heart and it controls the heart rate. So this is what's going to make your heart beat faster or slower depending on what you were doing. So as we know from our questionnaire earlier, we know that the sinus node starts the heartbeat. By sending an electrical wave to the atria. This is atria. Making the atria squeeze. The heartbeat has to get to the ventricles next. Yes, Estella?
How does it send out an electrical wave?
It just, that's part of what it does. It just sends out the wave, which would make it move and make the muscles squeeze. So the electrical current makes the muscles contract. So the heartbeat has to get to the ventricles next. To do this, the electrical wave goes between the junction of the upper and lower sections of the heart. So it needs to go through here. Called the atrioventricular node. So the atrioventricular node, its only job is to delay the signal of the heart and the signal of the heartbeat, and then send it to the ventricles to make the ventricle space. This completes heartbeat. So now let's do a review again. So So the top of the heart is called the what?
Atrium?
Atrium. So when it's plural, it becomes atrium. And the bottom sections of the heart are the
Ventricles?
ventricles. And so the heartbeat starts at the sinus node, it's going to move to the atria and go into the ventricles. But to do that, it needs to go through the atrioventricle node, which then will create the squeeze of the ventricles. Make sense?
Where is that on our diagram? The atrium ventricle.
The atrioventricle, it's right in like here. So kind of that meeting point. So now I'm going to simulate what arrhythmia looks like.